banged up? Who's in the training room? It's time for the Dr. Lox Sports Injury Report. In pain, don't operate, rejuvenate. DrLox.com.
Well, it seems like we always have injuries to talk about here in Tampa Bay affecting some of the biggest players, and it's great to have this guest. He joins us every week at this time, Dr. Dennis Lox. Good morning, Dr. Lox. How are you?
Good morning. How are you?
Well, we're doing pretty well, and let's get started first with an interesting scenario involving the Tampa Bay Lightning's Ryan Callahan. He had an emergency appendectomy on, I guess it was, would have been Tuesday night? Yeah, Tuesday night. Or Monday night. Monday night he would have had it. My son had this procedure a couple years ago, Dr. Lox, and I realize he's not a professional athlete, but he was sort of out of commission for about a week. What can we expect from Ryan Callahan? How long does it take to recover well enough to be able to go out and play a physical game like hockey?
Well, the technique of these appendectomies has gotten so good with laparoscopic surgery that they can recover really quick. If there's no pressure with an athlete, you can give them a week as much time as you want. But there's precedence in sports. I think the Red Wings a few years back had Jonathan Ericsson come back in 3 days during the playoffs. So if it's needed, you'll have a little bit of pain, but you can get back. It's such a minor thing now, what they're doing with these small incisions and the microsurgeries, that the trauma of the big abdominal surgeries just isn't there anymore.
Dr. Lox, would there be any dietary or weight loss or residual effect? Would he be weakened at all, you think, when he does come back?
I don't think so. I think that these athletes are such highly conditioned, just a few days or a week isn't going to do anything. And you can continue to, do things to other parts of your extremities. And with such a small incision, again, you just do not have the layup that you had years ago when they made these long open wounds where the whole abdominal cavity was just incised, and there just isn't the pain with that. So they bounce back quickly, but there'll be a little bit of soreness if he's needed to return in the next few days. But if they give him a week, then he'll do real well.
Yeah, I know you haven't examined him, and it's probably a little bit unfair sometimes to ask when a specific player might be able to come back. But if he had it Monday night, would there be a chance he could play Saturday?
Yes, I think so. I really do. I think that it's whether the team really needs him, and you may be a little sore, but I think in today's day and age with these microsurgeries, it's just not as difficult or as traumatic to the body, so they can do it.
Dr. Lox, Drew Smyly, the Rays pitcher, has a torn labrum in his throwing shoulder, and there has been some talk that he may decide to rest and see if it's possible to pitch later this season. How realistic is that?
Well, I think it's a tougher picture in the overall, Rays dynamics. I mean, they lost Alex Cobb last week to the Tommy John. Matt Moore was out with the Tommy John. So they've got such a difficult position problem with pitching that has to play into this as well. I mean, the problem with him is he was out with his shoulder tendonitis for so long, and now he comes down with the torn labrum. One has to think that the labrum was sort of involved all to begin with.
Right.
It's such a dynamic thing how a pitcher throws. The rotator cuff and overlies the glenoid labrum is just a tough fibrous capsule in the ball and socket joint of the shoulder, and if the labrum is torn, it makes it very, very difficult for a pitcher to continue to throw with the velocity and the endurance, and so one has to think that this has been brewing for a long time, and the tendonitis was just part of the overall picture. That just his shoulder was just getting weaker, and I think that now it just goes to show that his arm was really much worse. So that is probably one of the big decisions, in that he's been having problems with it for so long. But I think you have to look at the overall pitching rotation, it makes it real tough if he does go out.
We're talking with Dr. Dennis Lox. He joins us every week with our injury report. And Dr. Lox, I mean, how realistic is it that if just some rest is going to end up fixing this problem? Is he going to be able? I mean, would you? I know you haven't examined it, but would you advise that? I mean, would you think that he's eventually just going to need the surgery?
I think that it's a thing in this particular case that may very likely happen because he's been plagued so long. But I still think that having him go down with the other pitchers is just makes it a more difficult call. I think in any other circumstance they would probably pull him and he would opt for it. The thing is, he's young, he can bounce back better than some of the older pitchers, but there is such a high number of pitchers who don't make it back that makes it a difficult decision as well. So I think that you have to look at all the dynamics involved with this, in that some people don't make it back, and then there's already so many pitchers in their rotation that's gone out that you have to look at all of that if he does have the surgery, he's gone the whole year.
Right. Well, that's good stuff, as always. Well, disappointing for the Rays, of course, but great insight, and we appreciate it. We enjoy talking to you every week, Dr. Lox. Thanks so much.
I appreciate it. Thank you.
Thank you. And that was the Injury Report brought to you by Dr. Lox's Sports and Regenerative Medicine. Want more info? Visit drlox.com. In pain, don't operate. Rejuvenate. drlox.com.